All right, to this now. Gauteng Health has been warning about sexually transmitted infections that have been on the rise since early last year. At the same time, the World Health Organization warned of low preventative and testing measures across the world due to the 2022 COVID-19 lockdown restrictions. Well, joining us now is Maeshela Maheya, Programs Manager for STIs and HIV Prevention at the Gauteng Department of Health. Good to have you, Maheya. Thank you very much for coming on this afternoon. So STI cases are on the rise and they continue to rise. What do we understand when we are firstly looking at detection, also looking at the transmission rise, are the factors that are leading to this?
Good afternoon, Thabo, and good afternoon to the viewers at home, and thank you for having me awarded this opportunity to come here. Yes, since 2024 in December, we had our new episodes of MUS, male urethritis syndrome, rising to 13.1. But since then, as a department, we came up with a strategy to take the services to the people by having campaigns around sexually transmitted infection screening and management and condom usage at our TISH, that is our township informal settlement and hostels, as per the mandate of the Department of Health, MEC.
Is there something that you have done surveillance-wise in terms of performance that is giving you, I suppose, more ability to detect, or is it a lack of education around STIs that is leading to the rise? I'm just trying to ascertain what is actually the factor that is driving this rise.
Okay, most predominantly the factor is around behavior change. But as in the issue around screening, where the department has now come up with a detection test, we are now having the HIV and STI screening test. Is a dual test wherein you screen HIV and you can also be screened for HIV from STIs. So the issue now, the main issue is around condom usage, because that's where the challenge is, especially among the youth. So it's very much what we have done now, the campaigns that we were embarking on, is to demonstrate how the condom is used. Yeah. Because much as we are having condoms, but if our citizens don't know exactly how to demonstrate or how to use the condoms, that's where the challenge was. But like I said, we have massive campaigns wherein now we have a number of citizens coming, because the more the clients come, that's when we get to check whether the STIs are high or low. But now we cannot say they are high, meanwhile we don't have more people that are being screened. So the more clients are coming for being screened, that's when we can detect whether they are high or low. But as in December, we're having 13.1% of the new cases for the third quarter. So we are still waiting for our report. But since then, we had massive campaigns to keep the rise of STIs.
What notification data informs that conclusion that there is a major difference in condom usage, or at least non-condom usage?
Come again?
What notification data, what notifies you? What information are you looking at that tells you that there is a difference in the pattern of condom usage or non-usage of condoms?
Okay, the pattern that we use, we're having, the indicator that we have is the HIV testing. So we check around the number of condoms that are being distributed, and then we also check the new cases of HIV. That is the measuring stick that we are using. Then that is the one that is telling us that the population of the citizen between the age of 15 and 49, that's where we are having a challenge, because most of them, that's where our new HIV infections were revolving around.
And where are you relying now to be able, I suppose, at a community level to spread the correct message and, I suppose, the distribution of the condoms, but also the testing?
Now we are relying on the institution of higher learning. We're also relying on the townships, our informal settlements, our hostels. That's where we're putting more effort on. So we are more on community campaigns.
What form do these community campaigns take? I mean, is it just people coming wearing T-shirts, branded T-shirts, talking heads? How are you getting through to young people, especially in spaces where they are and in how they are consuming information today?
Okay, how we are getting to them is that we design some campaigns. We get a venue, either it's a sports ground or whatever venue where we know that we're going to target, or a sports ground we're going to target more youth, or nearer the taverns, and then we come up with different forms of services. We don't only come with STI or HIV screening. We come with all kind of primary healthcare services, and then we mobilize the community. They're being mobilized before through our radio station so that they get to understand that we're going to have this kind of a campaign. Then when they come, that's where we teach them about different types of STIs, how they can be screened and how they can recognize them and how they can prevent them. Yeah. So we have a mobilization through our accessism team, and then we mobilize the clients 15 to 49 and even others outside that age group. Then they come as a campaign.
How are you broadening that? I'm asking you this because you want to reach millions of these young people, right? And the things that shape their sexual practices are not the things that I suppose you and I at our age would have done in our time and in our days, right? They, for example, watch Netflix, and those series and things that they watch there is what shapes and informs their sexual behavior. So how are you possibly shaping their behavior if you are not in those particular spaces?
Okay, we are having apps like Choma. Apps like Choma, it's wherein you can log in and then you ask different kind of questions pertaining to STI and how condoms can be accessed and how condoms can be used. So particularly we are now using the websites, like we are having a Facebook, we are having a WhatsApp, the departmental one, and we're also having a Choma app where people can access services around STI prevention and management and condom use.
Right. And what then targets have you set for yourself? I mean, in light of, for example, PEPFAR funding that has now also been reduced and some NGOs having to suffer, even though they're saying it's a fraction of that funding that would have come from there. But what targets have you now set yourself, at least in the next 5 years, you would want to see happening as far as those numbers are concerned?
As far as those numbers are concerned, we need to get 50% of the youth between 15 and 49, because those partners were just supporting us. Hence, we are calling them the supporting partners, but the services are still rolling within our facilities. So we're not solely reliant on the partners. So the services are still continuing. So we are targeting men, and then even now, mostly we are targeting men around the mines. So as and when now we conduct our campaigns, our target is mostly around young adults and men around the mines.
Maeshela Maheya, much appreciated, and thank you very much for coming on. She's the Programs Manager for STIs and HIV Prevention at the Gauteng Department of Health.